Welcome to Soul Science, the official podcast of Sports and Exercise Podiatry Australia. We're your hosts, Pat, Harriet, and Darcy. We're all sports podiatrists with a passion for advancing the profession. In each episode, we dive into the latest research, share compelling stories from clinicians, and feature special guests who've made significant contributions to the world of sports and exercise podiatry and lower limb sports medicine. Darcy, Harriet, good evening.
Good evening.
Evening, Pat. How are we?
I'm fantastic. I've just come from the gym after a day of clinic. Yourself?
Very nice. Yeah, actually had a little spell too.
Harriet, how's Sydney?
Yeah, about to start maternity leave this week, so
Oh, that's
I'm in a
exciting.
very good mood.
Well, I think we're all excited for our guest, Dr. Chris Bishop, a world-leading expert in sports podiatry and biomechanics, with a PhD in footwear, biomechanics, and plantar heel pain from the University of South Australia, and over 15 years of experience. His work focuses on foot function, athletic footwear, and human performance. Chris is the founder of the Biomechanics Lab and serves as the consultant biomechanist for ASICS, directing the footwear wear test program across Australasia. He also works with elite athletes through South Australian Sports Institute and Cricket Association, using advanced 3D gait analysis to optimize performance and resolve complex foot and ankle conditions. He's also a fellow of the Australasian Sports Medicine Federation, recognizing his outstanding contributions to the multidisciplinary world of sports medicine. What sets Chris apart isn't his technical knowledge, it's his relentless commitment to staying curious, doing the work, and continually evolving, whether it's publishing research, mentoring young clinicians, or refining orthotic interventions at the elite level. Chris brings a mindset built on hard work, long-term thinking, and personal accountability. He's a passionate researcher, a pragmatic clinician, and someone who embodies the quiet persistence it takes to build a meaningful, lasting career. Chris, welcome to Soul Science, mate.
Thank you very much, Pat. It's quite an introduction, mate. Appreciate it, and good to always chat.
Nothing but the truth, mate.
Appreciate it, mate. Kind words.
What do you think defines excellence in our profession today? In a crowded space of, clinicians, tech, and opinion, what sets the best apart?
Yeah, that's a great question, Pat, because I think sometimes with the available technology and the ease of access to it, we can quickly be led by the more tech we have access to, the better. I was thinking about this today when I was seeing a few patients, and I think I've got it down packed to the ability to quickly establish and articulate a diagnosis. I think that for me is the number one thing that sets an individual apart. I saw a number of new patients today, and I always challenge this myself of why are they coming to see me? And quite a few of them had seen podiatrists or physios beforehand, and routinely what I see is the lack of an accurate diagnosis. And we've had treatment, and we've had treatment over a long period of time, and we're treating without truly understanding exactly what the true issue is. And no matter what the pathology, that can largely be established or treated in a variety of ways. But for me, what I try to always do myself clinically and motivate my team doing is, until you've got a diagnosis, you can't have a treatment plan. So in that initial consult, the ability to quickly establish an accurate diagnosis, but articulate and educate your patient around that, I think that is absolute gold.
Fantastic. Well, let's get a deep dive into your work. I was reading the paper you co-authored in 2021, looking at the effect of orthotic stiffness on running economy in lower arched, runners.
Yep.
Can you give us some important takeaways from that study?
Yeah, it was funny. We were actually talking about that paper in the lab yesterday, because my sports scientist, sort of Grace, who heads up our performance lab, she was actually one of our participants in that study, and that was the first real study where we started playing around with variable thickness and 3D printing. And what was really curious and brought that on, Daniel Crago was one of my honours students, and he did an amazing job. He was a physio honours student with us a couple of years ago, and we were seeing a lot of runners at the time, and at the same time, I was doing my postdoc with ASICS, looking at running physiology and footwear development. And what we were seeing, there was a lot of work coming out with regards to foot function in running and being controversial, even largely at this point, a lot of Luke Kelly's sort of work that he was publishing in regards to foot function and regulation of arch stiffness and, looking at the concept in regards to the windlass mechanism and really challenging the status quo. And what we kind of looked at when we're looking at runners is the athletic orthotic over a period of time had largely been based around this, carbon fiber type device. As I was sort of training through, it's like, oh yeah, let's use TL 2100 or yet let's use polypropylene. But the concept with regards to that was that that was a consistent stiffness the whole way through the orthotic. But when you actually sit there and think about what the foot wants to do, in running, you don't want a consistent stiffness the whole way. You want to be able to use those plantar intrinsics, even, tibialis posterior and the extrinsics. You want to be able to utilize the stretch shortening cycle of all of those muscles and tendons. And what we wanted to be able to do is go, okay, well, if we're trying to unload a specific pathology, and we focused on that flatter arch foot, and to be able to assist the ability of tibialis posterior to optimize the control of the foot during running, we very quickly worked out that the orthotic reaction force needed to be applied distal to the insertion of tibialis posterior. And so after the insertion, so largely through the midfoot and the tarsometatarsal joint, in some prototyping, we actually found that if we reduce the stiffness through there, but increase the stiffness through the subtalar joint and the calcaneal, essentially the calcaneal inclination angle, we didn't actually lose any functional effect of the orthotic, but we're absolutely able to improve running economy. And so by what we felt, tuning essentially the foot and giving the mechanical correction to assist tibialis posterior to do its job, not only do we end up with a more comfortable orthotic, but we ended up with an actual orthotic that changed the physiological exertion of running. Now, like anyone in lab studies, there's obviously, randomization and stratification across different conditions. But that was the first sort of seminal piece of work that we did that changed my outlook on how we make orthotics and for athletic performance.
That's really interesting, Chris. How much were the economy improvements that you guys measured? Was that with a gas exchange?
Yeah, we saw a gas analysis, and to be honest, I'm terrible at quoting my own papers, mate. So I don't have it in front of me at the moment, but it was in the sort of version of sort of 2, 3, 4%.
Yeah, okay. Yeah. What
Do you
shoes were you
think?
guys wearing with that? Was that sort of with some standard ASICS shoes?
Yeah, we used the ASICS Dynaflight at that point. And I think one of the really key considerations to look at that and running economy is the running economy finding, as much as that was beneficial, wasn't the key consideration that what we took out of that. What we found is there was, like anything, variable changes between people in the population
Mm.
and the responses differed as a result of individuals. So there wasn't one consistent aspect where everyone looked at or everyone performed or responded in the same manner. And again, this has largely changed the way that we run statistical analyses in our lab now, in terms of we largely run what we call a mixed model now, where we look at individual responses rather than a group effect. And it's probably one of the criticisms I have of the literature and this aspect of, go and run in a super shoe and you're going to improve your 2K time trial by X, or you're going to improve running economy. Some will, some won't. Some will have big, 9, 10% changes. Some will actually be less economical. So for me, it really is about that individual response.
So based on that research, Chris, and what we know today with 3D printed orthotics, do you think we're past the traditional vacuum pressed manufacturing process and we should be going towards 3D printing where we can control different thicknesses and different densities in different areas?
Yes. To give you a really blunt answer, Pat, yes. I think the foot is an incredibly malleable and compliant structure. And for me, the way that I've always tried to look at orthotic therapy is to optimize the ability of the foot and ankle to handle the external load being applied when you run. So if you're looking at that seesaw effect where you're looking at the balance between internal and external load, for me, what an orthotic allows you to do is modify by introducing an orthotic reaction force in multiple areas of the foot, it allows you to change the position orientation of the ground reaction force vector. So you change how the force is being applied. And when you do that, instantaneously, you can change the balance relationship between what the internal load capacity needs to be to largely maintain, that equilibrium in the system.
So do you 3D print in your lab now as a result of that?
Yeah, so we use a lab out of Melbourne. We use footwork to do arranging, and I think most of the labs are starting to move this way. But I've been 3D printing probably for 7 or 8 years now, and I was the first. I was the big. You go and ask lots of labs that I sort of spoke to at the time. I was the biggest critique of the process. It took me a long time to adopt scanning. I was big on the plaster cast and the accuracy of it, and they had to prove, and they said, look, send me through your scans, send me through your cast. And again, they actually went out of their way to look at, this is essentially the scan you got, this is the foot, here's the accuracy, overlaid it, ran the statistical models. And so you can become a creature of habit and become very comfortable in what you do, and the way it's worked for the last 20 years is the best way that it's been done. But you've got to embrace innovation, and particularly in this world that we're in now, like with AI and machine learning and all of these sort of things, you can't just rest on your laurels of what you've always done. You've got to stay with the times. And I kind of have a motto in our place of that: you either innovate or you die.
Chris, what material do you prefer with some of the rigid 3D printed devices? I think at the lab I use, there's a nylon which seems to be sort of quite stiffer and maybe stronger in a thinner device, and then a polypropylene which is a little thicker and maybe a little stronger but less bouncy. What do you normally use, or what did you use in that study?
In that study, we use PA11, and it's the same stuff that we use now. The concept for us is and largely it's in terms of the tetrahedron shape, and I don't do the 3D printing myself. That's why I've got the lab. But I think the biggest consideration is optimizing stiffness by, yes, you can play around with the tetrahedron and then the setup of the individual matrices of the orthotic. And I'm going to try and sound like a materials engineer here, and I'm not. For us, what we've tried to do is we prescribe thickness in areas based on the angular velocity of the rotation occurring about the joint, as well as the external joint moment acting around that joint. So basically, if we have a high force trying to, let's just say, pronate the subtalar joint, or eccentrically lengthen tibialis posterior, that needs to be equal and opposite going back the other way.
Chris, if we go further back in time, maybe 12 months before this study, you were doing the running shoe comfort assessment tool, or RunCat for short. I thought that was quite an interesting piece of literature. Obviously, in my practice, I like to do comfort first before kinetics, just because I find most patients deal with color and comfort much more than what I think is the best. However, how do you use the results of what you found with this tool, and what sparked that idea in the first place?
Yeah, good question. And I'll give credit to Mark Doherty, who was a stalwart of ASICS for a long period of time, and he's no longer with the company. But he and I spent a long time together. I'm just going on sort of, what did I work out the other day? I'm going on close on 16 years working with them in collaboration. It's been a great journey. What, though, established us is, or that study, or inspired that study, is clinically, I saw when I prescribed footwear and they went into our local retail stores, that comfort was the number one thing that influenced someone's buying decision, outside of color, in those people who were slightly influenced by that. And I said, well, at the end of the day, let's just be really practical about this. If a shoe's not comfortable, they're not going to wear it. And that's what it came down to. And I had numerous situations where, we were looking at, like, there was still that, we're talking back in the times of, DS Racer and DS Trainer and, still technically longitudinal bending stiffness shoes and sort of nylon plated sort of through different truss stick systems. And some people loved them, some people didn't like them. And they just said, no, I just didn't find it comfortable. And that was the information that kept coming back to me in clinic. And I've always tried to have my research program be pragmatic, whether that was my RCT that we did as part of my PhD, where we said, you know what, we're going to accept that some people are going to respond in different ways, and it's not going to be the most controlled trial because different people are going to get different orthotics, but it's real world. Right? It really is what happens. And I think clinicians have appreciated that about some of our work over a period of time, is that you accept some of the limitations that come with that, but at the end of the day, it kind of represents clinical practice. And so that's what we wanted the run cap to be, is rather than just being this aspect of, on a 0 to 10 analog scale and where you anchor at just one end, we wanted to try and find a way where we could anchor the comfort phenomenon to footwear design. So what we did in that study is we went and got basically 3 levels of running shoes. Like, in one aspect, we ended up with an Onyx Super Tiger, which can go back to the 60s and 70s and people winning gold medals in them. But then we went right to one end of the Nimbus, and then we had a mid aspect with the Contend. And we asked people to just go and run a 1.2K time trial around an asphalt surface. It was around the block, around a clinic that we had. And we asked them to assess the comfort of a range of factors. But that comfort tool or the list of criteria we had was very much determined by a consensus survey that we put out and got, the best part of 300 odd runners are going, well, what actually is important when you assess a shoe? Is it the depth? Is it the heel counter? Is it the forefoot stiffness? Whatever it may be. And so we got the most common ones, and we asked these runners about running in every shoe in a randomized order to assess their ideal, or their perception of ideal of all of these things. And then, most importantly, at the end, we asked them to assess their overall perception of comfort of that shoe on a 0 to 10 scale, or a 0 to 100 millimeter scale. And then we threw it into a sort of a big mixed model and a regression equation, basically to sit there and go, what factors actually influence the comfort perception? And what that allowed us to do with, statisticians working on this a lot smarter than me, is allowed us to look at the percentage contribution to the overall comfort phenomenon. And the 4 things that came out of that were essentially heel cushioning, forefoot flexibility, forefoot cushioning, and shoe stability. And they explained a very higher magnitude of the overall perception of comfort. And so what that allowed us to sort of do is go, well, hang on a second. We can kind of now got an objective assessment tool for footwear that I can assess some of these samples or wear tests that are coming through, and allow them to go, oh no, that's too stiff, that's not too stiff, that's got good stiffness, this isn't stable. And it was directly related to the comfort. And we saw the individual factors associated with, forefoot cushioning and forefoot flexibility being some of the most important considerations in the overall perception of comfort. And, I'm not saying this has necessarily influenced the trend, but look at a lot of the footwear that's coming out. So much emphasis is on the forefoot and how that can be used to optimize athletic performance. And that's exactly what our comfort tool showed back in 2015.
So with I guess now in the recent years, 2-hour marathons being broken and super shoes coming out and a whole bunch of different foams from TPEU to P-backs and all this sort of stuff.
Yep.
Do you feel like this comfort tool, or the 4 key pillars that you've just described there, not including shoe comfort, are they still valid for the current crop of shoes that are coming out now?
I think so. And I think there's one big caveat, and I was just talking to a whole bunch of Kiwi pods actually in Fiji, of all terrible places to speak at a conference, with the Shoe Clinic group. And I think one of the biggest issues that's facing footwear prescription right now is this hype and this perception of what I should have, not what I need.
Yep.
and I need to be in a super shoe, or I need to be in a plated shoe, or I need to be in this because someone that's a hell of a lot better and more experienced runner is in this shoe. And I think that is influencing it. And so there is absolutely a role, and not to keep the retailers in the job, but and I'm seeing this clinically, and I don't know what you see in your clinic, mate, but I'm sitting there and seeing when it's really obvious when I've got a runner who comes into my clinic that's had professional advice about selecting shoes.
Yep.
And in those situations, I think it is relevant. Is at the end of the day, if I'm a heel striker and I'm going to hit the ground harder and I'm going to have a loading rate of 50 body weights per second, I'm going to want a level of cushioning associated with that. If I'm sitting there and I've got a little bit more of an Achilles, overload, and I'm a mechanic, I'm a masters type runner and I'm struggling with some pain, hey, a little bit of a rocker forefoot is great. Now that's still going to be related to the optimization of forefoot flexibility, even though it's slightly stiff. That perception of the ability to get up and over, we've noticed, irrespective of longitudinal bending stiffness shoe, the way that consumers are responding to the perception of forefoot rocker is in the same sort of manner. So absolutely, I think it is. And we have certainly seen a consistent trend and I'm going to use the Kayano and the 2000 example. And as much as these days with ASICS, I'm working mostly in core performance. Certainly, when we go and test a lot of the product, as you've started to go and take trustics out of shoes, and we've started to use geometry and midsole base nets to be able to provide that, the stability metrics have largely stayed the same through those shoes, even though the way that stability is introduced into these shoes is different. So I think absolutely, it's just because it was built and established a few years ago doesn't mean that it is necessarily outdated. We still use it. I still use it clinically. A lot of my retailers still use it as a concept, and I think it still holds up. There's a lot of other factors now, given advanced footwear technologies.
That's really interesting.
Chris, with respect to the advanced footwear technologies, for sort of beginner and novice runners and intermediate runners, what are your thoughts on these athletes wearing super shoes? Either, say for example, it's a 3:30 plus or a 4 hour plus marathon. I know that research does talk about a small performance advantage still with runners running marathons at that time. I think Saucony did their self-funded study.
Mhm.
In terms of maybe injury risk and other ways that the AFT affect runners, what are your thoughts there?
Yeah, mate, it's a great question. And I just had this conversation in Fiji recently with, 20 great pods out of New Zealand and probably, one of the leading footwear retailers out of New Zealand. We had this exact discussion of the relevance of that. I think there's a couple of parts, and I don't necessarily have all the data to support this. These are just my opinions. I think, first of all, it's pretty clear these days the advantage of the performance benefits are largely because of the foam, not necessarily because of the plate.
Yep.
That's the first thing that I'll sit there and say. And so, I use an example of something like the Super Blast. Mate, that shoe is that is as stable as a Nimbus, right? That could be used by a lot of people. And I think you can have fun with running. And I think what advanced footwear technology is enabling people to do is change that running experience. And that's great. Like that's real key. What I don't love in novice runners running at that let's call it 6 minute K. I don't see the advantage of a plated shoe at this stage. I really don't. I think the plated shoes, and this is just my opinion, I think they're velocity dependent. And so I think that you need a certain amount of speed to facilitate the mechanical advantage of the lever arm that you're going to get from this plated shoe. And you're starting to see a couple of P-back sort of plates and nylon plates starting to be introduced to down-regulate some of that forefoot stiffness. And I've certainly, we've got a couple of sports physicians in town here in Adelaide who actually genuinely believe that a lot of, particularly in female adolescent runners, a lot of the pelvic girdle and high femoral stress responses they're seeing, it's uncanny about how many of those are in carbon plated shoes. And so if you sit there and think about, that proximal redistribution of work that's actually occurring, if your foot can't do some of that work naturally, which is what I try to do from a strength and conditioning point of view, maximize the stretch shortening cycle and look at it from an endurance point of view. If the foot can't do that, well, we know that there is a proximal redistribution up at the level of the hip. And so from an endurance point of view, yeah, at a 5K point of view and make it fast and that, I'm okay. But sitting out there going and running a marathon or a half marathon or an ultra in these type of shoes, where we may not necessarily have the endurance and we know that fatigue is going to change that neuromuscular status of the individual, in the presence of fatigue, having a shoe like that, I actually think that's when you actually want to use your foot more, and the plates inhibit your ability to do that. So put it this way, it's not a recommendation of mine in my novice runners to go into a carbon plated shoe.
Mm.
Yeah, it makes sense. It is good that we do have the options of, say like
Yeah.
a Mizuno Neo Vista or a Super Blast for those runners where they can get the performance foams without necessarily having to deal with the mechanics changes that come along with the plate. It's good that we do have all those options now.
100%. How complicated is the running wall right now, right? We had this discussion the other day in clinic, is that, you used to be able to probably, and you may well still be able to, but you used to be able to go and sit there and probably, perform, or satisfy 80% of runners with that 20% of shoes. Now there's just so many options, and that can be overwhelming and that can be confusing, particularly if you're for that online shopper. And so for the retailers out there or the pods, the role in appropriate footwear selection has never been bigger than what it is today, in my opinion.
And sorry before we jump off, Chris, with respect to the ASICS Metaspeed range, just have this burning question about it. Were you involved in that much?
I was involved in it early doors. I haven't been, so I saw it. I did a fair bit of work of that early doors when it was sort of coming off the back of some of the 4% sort of work. I haven't been involved in some of the running stuff. That's largely been out of Japan and the Center of Excellence out of Boston. But I've certainly tested a high portion of the footwear, but I wasn't involved in that development.
Yeah, because that was a very interesting where ASICS did bring in their model of the cadence runner or the stride runner, and then the primary difference was the plate positioning, sort of high-low with the edge versus the plus, wasn't it?
Yeah, and that's the thing. It's basically either you got a plate that's running right the way through, really close to the top of the foot, and then the minimum aspect of foam over the top, or then you've essentially got that curved sort of plate that then goes down. I really like the curved plate, okay? And the reason why I like that is essentially a curved linear aspect allows you then to get mechanical lever advantage. But dare I say it, allows you actually to have more cushioning underneath the forefoot, which is where I think most of the people actually need it. And so from my point of view, when you've got a greater ground contact time, because you're not running at that speed, what we know is that when you've got your plate higher up, closer to the foot, there's an increase in stress in the metatarsals as a result of that. And so there's less cushioning and increased stress associated with the plate. So if you've got a greater ground contact time and a lower cadence, you're not running at that recreational running speed, and you can't allow the foot to do that, you're actually increasing the load being applied in that second and third metatarsal. So I think the closer the plate is to the foot, the faster you need to run, and the faster ground or the smaller ground contact time that needs to be that, faster up tempo type runner.
Yeah, that's a really interesting way of putting it. That paradox between the plate, stiffening through the forefoot, supposedly taking load off. I guess that is an interesting point. If it is putting the forefoot and the heel essentially at a pitch, it might increase loads that way.
Yeah, and look, the plate changes the mechanical lever, Darcy. Like, we know that, right? The laws of physics, and you just have to look at a moment arm or a free body diagram to look at that. I still argue, and if you look at, Pat was probably going to ask me about, one of my seminal papers. If you look at any of Tim Dawn work and even come out of University of Melbourne, right, we know at recreational running speeds, all the work is done by gastrocnemius to generate propulsive forces. And I just feel in these recreational runners, that is the number one thing that needs to be focused on them, and actually generating those natural physiological properties in the muscle and working along the force velocity spectrum to be able to generate force consistently for a period of time at a higher velocity. Run faster, you need to be able to generate more force. If we try and cheat the system with these advanced technologies, yeah, we can probably do it, but I don't know for how long.
For sure. It does make a lot of sense to get the conditioning in a way that isn't being helped.
100%.
Yeah.
Chris, you said before that foams have been the core game changer over plates. I guess last time the Institute of Sports Science ASICS guys came down, I kind of hinted should guys be using like P-backs or TPU inner soles that are nice and thick to kind of influence that for comfort and performance? NDA notwithstanding, do you have any inside information from ASICS at the moment with any new materials or innovations coming out?
I don't have any necessarily with ASICS, but I'm not sure if you're familiar with the concept of ATPU and essentially that type of foam. I've actually got a very good mate of mine at the moment hiking the Pacific Crest Trail in America, and credit to him because he's doing it for a great cause. He has an ATPU full printed insole in there, and he basically sits there and goes, "It is like I'm walking on rockets every day." And I think this is the mechanical advantage that's going to come. I think in terms of the availability of materials to be able to make orthotics out of. And I know, Tom DeCanto has had a fair bit to do with the ATPU side of things as well. And, I haven't had a good chance to chat to him about it, but yeah, we're going to see with material engineering and 3D printing, as we can start to print with materials, we've got to understand what are we trying to achieve. There's some people that need biomechanical correction, but the
Yeah.
most exciting thing I think is available to podiatry is in performance optimization, okay? Because that's very much been and done in a support science. But if I sat there and said, okay, Pat, you got a foot, you don't necessarily have any problems, but if all of a sudden I can sit there and provide you a strategy that improves comfort, essentially reduces the magnitude of load being applied, particularly on, say, a pre-season surface in a pair of boots, where you're going to get that hard stiffness, and it allows you to keep your running loads up and you're not getting the negative effect associated with that, you're going to say, yes, please. And they're the things that are going to be available to us. So rather than going, hey, we've got a pathologic problem and we need to, offload tissue stress in this particular way, how do we actually look at this as an injury prevention strategy? That's what I love. Now, that's what footwear has been for us for such a period of time. But as footwear has evolved and we started to understand material science a little bit more, I think the option and the opportunity for podiatry in terms of optimizing that inside the shoe, that's an untouched gold mine.
Have you had much to do with that ATPU in orthotics at the moment? And if you have, what sort of densities are you using? Like, are you using 1 mil, 2 mil, 3 mil? And how are you
Uh,
gluing it on?
so I'm milling out of 45 mil ATPU
Oh,
block.
okay. Wow. Okay.
Yeah. I might get killed for saying that by a certain lab, but that's what we've done, and we've been playing around with that. At the moment, I'm using a TPU on all of my sets, so I've largely got rid of PPT as a top cover. I'm a Spenco guy, don't get me wrong. Spenco
Yep.
drives me insane from the delamination, but it's an amazing material. But I'm Spenco into ATPU, so I'm either 3 mil Spenco into 3 mil ATPU or 3 mil Spenco into 1.5 ATPU. It does respond differently, right? It absolutely does. It's a little bit firmer, but the durability in the axial forces in every direction is far superior than anything I've seen.
Chris, so with that ATPU, is that the aliphatic TPU?
Yep.
Yeah. Is that sort of somewhat similar to Puma's performance foams, just in terms of the chemical structure?
I think so. I haven't got into the chemical structure of it. It's
Even the
been
mechanical
something.
properties.
Yeah, and so it's actually something I've got a meeting about after this podcast. I was meant to be in it today, but I got caught up in the clinic, and so we're really in the early phases of understanding that. We're doing a couple of orthotic based projects at the moment, of trying to understand materials a little bit more, because the hardest part in biomechanics stuff is in this is actually measuring load inside the shoe. That's the hard part, and one of the most exciting things that we're doing, and credit to Daniel, my engineer, who's an absolute jet, is we've actually now found a way to quantify the magnitude of the orthotic reaction force being applied directly onto, in this situation, the medial tubercle of the calcaneus. So,
Do tell. Do tell.
yeah, well, come to the podiatry conference, mate, and we may well be presenting some data, but we've basically got wearable sensors that we've worked with some suppliers on, that attach directly onto, we apply them directly onto the skin surface, over key anatomical landmarks. So not to give sort of too much away because we're in the middle of this, but we've got one right underneath the center aspect of the heel. We've got one right on the medial tubercle. We've got one on the highest point of the medial longitudinal arch, and then we've got one over the calcaneocuboid joint. And the concept there is that we're looking at custom orthotics versus shod versus prefabricated orthotics in terms of being able to quantify that sort of net internal dorsiflexion and inversion moment. And what we're seeing early doors, and no one shoot me for giving a pre-teaser, is we're sitting there and seeing when we design a custom-made intervention, we're seeing an earlier application of the orthotic reaction force and a greater impulse, so a greater force over a period of time. But then when around that medial tubercle, but when we actually sit there and see from the medial longitudinal arch, we're actually seeing less force being applied there than in a prefab device. So again, that concept of bringing on from the work that we did with Dan Crago is we want correction and force being applied around the subtalar joint and the medial tubercle, but we want to allow some mobility around the tarsometatarsal joint for storage and release of elastic energy. So that's really, really promising and very exciting what we're doing.
Wow. I look forward to seeing it. When do you feel like that's going to be ready for publish the data?
We're going to be presenting some study on the Gold Coast. We're going to be presenting some of the data on the Gold Coast. So we've had 20, 30, 40 people sort of through that where we've piloted in different ways. What we've tried to do is, and again, curious mind, as you talked about at the start, mate, that's where it all started, is that we're just quantifying the effect of the different orthotics that we're prescribing for people to be able to sit there and go, okay, well, if this is an orthotic modification that's available, well, what is it actually doing and how does it work? But the plan is certainly to take that through to full publication, because I think the technique we've developed is pretty novel, and the data we're seeing is pretty mind blowing.
Wow. I guess moving on to one of the main sports you work with, like cricket, where do you
Yep.
think some footwear, training loads, and physical stresses are quite unique? Are there any specific tips around orthosis design and manufacturing for bowlers and fielders?
Fast bowlers hate orthotics because they snap them in half. So yeah, look, I do a lot of work in cricket. I do a lot of work in netball. I kind of leave a lot of the sort of the footy and round ball codes to a couple of colleagues. We've got some great sports pods with us here at TBL, which makes my life easy, and I just spend the time in the lab. I think I'm going to flip that on its head. Is rather than it being a conversation about orthotics, it's got to be a conversation about the load being applied on the individual limbs. And the thing that I find most rewarding about working in cricket is the asymmetry and load between the front foot and the back foot. Now, whether you've got essentially a side on a mixed technique or how they approach the sort of the popping crease, I always find that back foot's externally rotated, creates a massive pronatory moment. No one loves an orthotic at that point. I have certainly worked, and we're going to be looking at cricket footwear. We've got a big project on that sort of kicking off in about August, September, looking at about how do you actually use the medial upper of essentially the shoe to be able to optimize that in a bit more of a way. But dare I say it's something like that ATPU midsole or EVA. That is, I'm a very much a PA11 3D printed aspect. In my cricketers, I'm probably the other way because the loads, they just struggle to tolerate that load. And I accept, given they're elite athletes, I accept some durability issues that might come because they just wear through it purely because of the magnitude of load. The amount of PA11 orthotics that I've snapped in fast bowlers is like you would, like you've had hot dinners, mate. But you learn a lot from that. And I think what you do is you understand it's just still a game of just balancing internal and external load. Your posterior impingements are important. Your Achilles are important. Your metatarsal stresses are important. And I just find yes, orthotics are important, but you've got to regulate your training loads in these individuals. And cricket is really advanced in that injury prevention strategy, particularly based on some of the spinal work that they've done, given essentially the incidence of pars defects and all of those things that go up the spine. And so in young cricket, they're still controlling how many overs they can bowl per session and then a maximum in a day. And I think that's really, really good. But I don't think we're there for a magic bullet of foot wear because given the loads, the shoes have to be really heavy and really stable and really durable, which sometimes can negate comfort. And what I'm doing in shoe 90% of the time is just optimizing in shoe comfort.
So just thinking out loud here, have you been able to develop a material where it's compliant during the bowling action, but for fielding and standing around, it's firm enough to have adequate, I guess, support, if you will?
No, we haven't, mate, to be perfectly honest. I'm probably doing less and less, well, not less and less in cricket, is that, with my stuff is that, I've gone a lot more into sort of, the core performance sort of work lately, just with change of hierarchy at different clubs. But I've still got such a backlog of cricketers, and this time of year, like largely we come to the back end of it. But it's it's one of those ones where as much as I love working with the fast bowlers, the all-round is the challenging one,
Yeah.
where they will pretend to be a bowler because they want to sit there and roll their arm over, but they've got to then be able to run in the outfield, and particularly with 2020 at pace, and then they want a shoe that they can also bat in, and so they want it to be highly flexible and basically run like a running shoe, but you've got essentially a stud or a spike that's going to create greater longitudinal traction in all dimensions. So it's really challenging. Well, when I see cricketers, I genuinely have to think. I always have to think, don't get me wrong, but they're the ones that really, yeah, you've got to dot your I's and cross your T's a bit.
Yeah. I guess that takes us to our tech and tools spotlight, gate, ways to innovation. Chris, you're a tech man.
I love my
You
tech.
use force plates, in-shoe pressures, and you got a nice gate lab. Um, how do you measure load and force in your practice?
Yep. So we've got a couple of options. So if you go through I guess the journey for us for a new patient comes in, an assessment with any podiatrist, they instantly go over RF scan or materialize. We've got a foot scan system that allows us to really early measure some plantar pressure loads. You do that, pre and post intervention of whatever you're looking. What that allows us to do is start talking in regards to force and pressure and impulse and momentum, and just starts the conversation. We've also got a set of in-ground force platforms. So they're actually triaxial. We've got all the Vold stuff as well, but the actual three-axial or triaxial force plates are in the ground, and they're biofeedback. And so again, if we're doing a calf raise or we're looking at essentially a double leg squat, we're looking at essentially pressure distribute or force distribution and asymmetry, left versus right. So we're always just talking about force to the patient so they can see that load. We've then obviously very lucky to have a couple of gait labs. So we've got a full walking lab that's got inbuilt force plates in it with a 3D motion capture system. And then we've also got an instrumented treadmill that allows us to run up to about 30 k's an hour and measure those forces being applied. Excitingly, based on some of the orthotic work that we've been doing, we now have an ability. We've also got, sorry, the Novell load sol system that allows us to do some external work outside the lab. That's limited because you can only sample at 100 hertz. So, there's a little bit of a frequency and a down regulation of the sample that causes a few issues there. But with our force sensitive resistors that we've managed to program, the ability to go and actually measure the load being applied out on the field is now something that we can do. But I think I was alluding to this when we spoke last time. The most promising aspect for us, and we're just waiting. We're just invested in a new sort of markerless motion capture system that will kind of redefine everything that we do. But we're looking at how we can use accelerometry and advanced neural networks or machine learning to be able to predict the ground reaction force vector out in the
Mm.
real world. And if we can essentially then do that to predict the ankle joint moment, because moment equals force times distance, we think we've got to measure a way that we can measure the work being done by the calf and the Achilles tendon out in the field of play. Now we've got really promising early data based on that neural network and machine learning aspect, and that's something we're continuing to evolve. But that's the frontier. Like podiatry, sports science, sports medicine, we need to come out of the controlled lab and we need to somehow get into the field of play to get real world loads, real world velocities. And that's the challenge. But we think we're getting close. And you look over in America now, there's markerless motion capture almost in every Major League Baseball. The NBA have just signed a contract across every team there to have 3D motion capture across all of their stadiums. So I think over the next 5 years, you're going to see a lot more of that infield play that's out there, and we're trying to stay with the times there as well.
Performance aside, how do you apply a lot of this to rehab and return to performance, and how much asymmetry data do you use with your rehab?
That is everything for us. So when we talk about rehab, we talk about it, we routinely talk in two ways to patients. We talk about a limb symmetry index, and we always try to optimize that. So the way that we present our reports, and we don't use standard reports, we've developed programs to articulate this for our patients. We visualize the difference between left and right. And the difference there is the limb symmetry index, and we've coded that plus or minus 10%, plus or minus 20%, and greater than 20% aspect, and that's red, orange, or green coded. So that gives the patient that nice visual feedback about where things are at. We then also got a percentage of target database, and I don't love normative databases, but it does. Patients really like knowing where they are relative to a certain population. So we spent a lot of time and resources in trying to create different populations based on age and status. Like a lot of the work we do in is orthopedic surgery. Then we do a lot of work in sort of high performance sport as well. So we've got different databases for different things. And then if I sit there and go, okay, Pat, you've just had an Achilles tendon rupture and you're 40% of where I want your calf to be, that gives you the motivation to be able to sit there and go, okay, great. Well, this is where I need to be. One of the things that we always challenge with is the role of isometric strength testing and how much that actually predicts dynamic function. We are very lucky that we can, in rehab, really quickly do 3D gait analyses to understand the work being generated about the ankle, the midfoot, or the foot. And so we can actually look at what's being absorbed or generated, and therefore the eccentric and concentric work. So this data benchmarks everything, every decision that we make in rehab. We generally test every 6 to 8 weeks, depending on what the procedure has been, and the discharge criteria, particularly in our orthopedic surgery program, will be very much based on gait analysis. This is why we've invested in markerless, not necessarily from a cost point of view, but what was previously taking us 2.5 hours will now take us 6 minutes.
How much does, in your experience, dynamic versus isometric, is there a correlation?
No,
Okay.
there's not. And I think the challenge with isometric strength testing is the magnitude of force, but more so the rate at which that force is being developed. And so the big thing for me is that in dynamic function, what we routinely see is the magnitude of force being generated times by the angular velocity. So dynamic function is speed dependent versus isometric strength testing is largely push as hard as you bloody
Yeah.
can. So we're not seeing a great correlation between the two. What we do see amazing for, though, is benchmarking progress. And so if I've got a baseline set of data on you and I retest you in 8 weeks, that is very reliable and very valid. If you change the way you walk in a gait lab, as much as it is, like there are variables associated with that. And that's how we've chosen to use isometric strength testing, is benchmark progress in S&C as an objective outcome measure.
Yeah. And in a lot of sports that use a lot of asymmetry, let's use cricket, for example, fast bowlers would generally only bowl one arm. So the
Yep.
leg would only go unilaterally one side. How do you use that sort of data, and how does that inform sort of your performance and rehab?
Yeah, look, that's a great question, and dare I say it, when I'm working in the elite environment, mate, I am largely giving them the data and allowing the S&C coaches and the rehab
Yep.
physios to do all of that, to be perfectly honest. But this is a great question, and this is why some people go, well, what does the asymmetry? Like, can you use a standard 85%, 90% asymmetry, and is that a return to play criteria? It's not. I think there needs to be functional performance outcomes, which is what we've chosen to do in our lab, of how do you actually develop the work, what's your ability to develop work over a period of time, what's your dynamic stability, what's your neuromuscular control status. It's all just one piece of data that goes into the whole bigger picture. I think where clinicians can go wrong is they become so regimented in this number needs to be this. And mate, you've seen it, I'm sure yourself. You can cheat isometric testing,
Yes.
and it is very easy to do that. And so if your only objective outcome is you need to hit this number and then you're good to go, that's fraught with danger, in my opinion.
Yeah, I agree.
Um, I guess for sports pods starting out and maybe even season pods, what are some cost-effective options? And, I say cost-effective, given this economy that we're in at the moment, but realistically, if you're going to be good and be good at sports and exercise podiatry, what would you recommend as tech that we should invest in?
Yeah, it's a great question, mate. I think an absolute no-brainer is a set of, it could be Volt, it could be Hawker Dynamic, a set of force plates. I think you can do so much with them. A handheld dyno, I think is absolutely amazing in terms of what it can do, and there's so much you can do in that. You can invest in a high-speed video and a range of things, but like honestly, and this is going to sound a little bit cliche, I think you just got to invest in your learning. You got to invest in your own knowledge. And if you can have the greatest tools in the world, but if you don't know what those metrics mean,
Hmm.
you can't do anything with them. And I see that all the time. Oh, I've had this test. Oh, great. What did you do with it? There is no point collecting data for data's sake. And this is something, my sports scientist has really nailed down as going, sometimes I feel I'm just collecting data just for the sake of it, in a range of different environments. And what that does is keep us accountable to go, okay, well, when we're sending into the lab, well, what is actually the clinical question that we're trying to answer? And you can't just have a recipe. You can't say, oh, I'm just going to have a full proximal profile, or just give me a full strength profile, or give me a full 3D. What's the question that we're actually answering? I'm certainly playing around with some ultrasound at the moment because I'm interested. So there was a cheap one going on Bridge the Gap the other day. So we got one. That's been really valuable in helping us understand some real early inflammatory changes that if ultimately, I had a great patient in today with an enthesitis and it was a psoriatic arthritis patient of the peroneus sort of brevis, and it lit up like a Christmas tree. And it's like, okay, there's clearly some stuff going on. And I don't use it diagnostically, but if there was nothing going on there, I'd probably go, I'll move on. Okay, well, hang on a second. We need to sort of settle that down. So it's helped manage my rehab. We identified an Achilles tendon rupture really quickly at a basketball game the other night. So there's a few different areas in that from a diagnostic skill set. Gait analysis is coming really quickly, and it's going to be a hell of a lot more cheaper. It's not cheap at the moment. Now, it depends on how you look at your return on investment, right? We've just gone and invested, probably another $250,000, and we'll do that over a 5-year ROI. But you've got to have a clinic big enough to be able to sit there and go, well, hang on a second, paying that off over a period of time. And so I think having the ability to look at gait, look at the back of your room, Pat, and having a treadmill, like there, things like that, and those core pieces of equipment are more important than the fancy things. You've just got to have the ability to assess and get to that diagnosis. You've got to have the ability to look at someone walk, run, jump, move. You've got to be able to have space. And then if you want to go down the rehab path, you've got to be able to have a way of trying to measure those loads in some way.
I got to ask Chris. I think we all would like to know. You ask the right questions. You have the right vision for what a sports and exercise podiatrist needs to be. What drives sort of that passion and that thought process? How did you get there?
Yeah, that's a good question, mate. And I get asked that a lot. Um, I've been motivated, and this will sound slightly arrogant, and it's not meant to. I'm motivated by doing stuff that other people can't. And for me, I've always wanted to think differently about what we do and defy the status quo. Go and ask my parents growing up, I was probably exactly the same. So I think the day you stop learning is the day you retire. And again, it sounds cliched, but clinical practice for me, and it's always been this case. You can just get in a routine. I need variety. I want to think about ways that come different. Now, again, I look at that and I go through times when I use a lot of gait analysis and then I do a lot of rehab and then I don't do it because I just find different ways. And so for me, it can never become a sort of recipe associated with I do this every time. I, as a clinician, just want variety so that I've got all the tools available to me when my patient rocks up and needs something, I've got it. And that's required a really big investment, don't get me wrong. Not only a financial investment, but a knowledge investment. And that's required me to be able to have not just the knowledge, but the network associated with me to support me at that point. And probably what I pride myself on now, and was what my most valuable asset is in sports and podiatry, is my phone book in my phone. Is that I know that I can ring up some of the world's greatest experts in different areas because I've made a connection with them. Whether that's been an SMA conference, ZEPA conference, ISB, whatever it may be, it's that I've surrounded with people with me and kind of had that philosophy of always be the dumbest person in the room and just leverage that experience. I've had great mentors over a period of time who have not just who supported me, but endorsed my approach. And I think when you get that confidence on those peers that respect you and go, this is what you're doing, and they go, yeah, mate, I fully support you. I think that's a great way. It just gives you a bit more confidence to continue to push that way. But no doubt we've probably pissed off, a few along the way. Absolutely. And I get that. But for me, we have always stayed true to our vision and purpose that we will be a biomechanically informed decision-making practice. And I think if you stay true to that purpose, it allows you to have a true essence and soul to your practice.
How would you motivate, I guess, the younger generation now that you've seen and done all these things? And on reflection, would you change how you do it?
What do you mean by that? Change the way I do it?
Or would you change how you do it? Or how would you motivate the younger generation if you have the opportunity, which you probably do right now? Because I guess a lot of questions we get are, Pat, how do you get into sports and exercise podiatry? A lot of students that come on placement, they're like, how do you get to where you are? I find it
Yeah.
sometimes easy, sometimes hard to have those conversations. A lot of us, we've done a lot of study and a lot of external stuff outside of podiatry. What are sort of your clinical gems or pearls that you would give to the younger generation?
Have a conversation, seek every opportunity that's available to you, and ask lots of questions. Mate, when I was young, and I had guys like Simon Bartold and Joe Hamill and a range of people endorse me who are 30, 40 years older than me. But what I did is I respected their time,
Yeah.
but I asked the right questions, and I was polite about it, but. I remember sitting there and going, "Oh no, there's Ben O'Nig, there's these people," and it's just like, great. That's just a person there. And so you can be intimidated by the reputation that someone might have. But at the end of the day, I've always looked at it and gone, there's a person over there that has an answer to a question that I want answered. And so if that's the case, if I don't take that opportunity to answer the question, what's the worst that's going to happen? He's going to tell me to get what's the worst that's going to happen there?
Yeah.
At the end of the day, I've backed myself in, and that's a really hard thing to do.
Hmm.
But over a period of time, I have never, and I can almost categorically say there's been one situation, right? But in, best part of 20 years doing this, I have never been knocked back by someone saying, hey, mate, can I just have 10 minutes of your time? Can I have 5 minutes of time? Can I just ask you a question? I've never been knocked back. And as much as I thought, oh, geez, this person, well, I'm no one to them. Why are they going to give me their time? I've invested my own time to be at conferences. I remember, 5, 6 years ago, I traveled halfway around the world because I knew someone was going to be at a conference because I wanted to sit there and meet them and I wanted to speak to them because they had a scope of practice in sort of rheumatology that I really wanted to get an understanding of. And I did it. Okay. And so I've always been really clear in terms of what I needed to achieve. And I think that's probably one thing I'd say to people is that be clear on what you want and have a vision. Now, that's hard to do, don't get me wrong, but if that's sports and exercise podiatry, you've got to be able to understand and go, well, what do I need? What are the skill sets that I need to be? And you've got to have a like if you want to be the best, and I'm not saying I'm the best, and there's a lot better sports and exercise podiatrists than what I am, but I think from a biomechanical, analytical point of view and the integration of high-end biomechanics into clinic, we do that really well. Um, But to do that really well, you've got to stay at the forefront and you've got to invest in that. And that is a relentless pressure. And you go and ask my team, I'm like, Chris, when are you going to stop trying to innovate? When are you going to rest on your laurels? You've got a great practice. And I'm like, guys, that's not how I work, right? I always are looking at going, how can I improve? How can I be the best clinician I can? How can I provide my patients the most value? How do I provide essentially an analytical framework that gives my patients all the information that I need, but gives me all the information that I need to be able to make clinical decisions? And the day that I stop doing that is the day I'm going to drink more red wine with you, Pat.
Um, I guess mid-year or mid-career podiatrists like myself, Darcy and Harriet, what advice would you give podiatrists like us who want to contribute to research, publish, or pursue like a hybrid academic clinical career like you?
Yeah, there's red tape you got to jump through. It's hard. I think I've had some really successful um, collaborations over a period of time. But at the same time, and I probably chose not to go down that big formal path of, I not got out of uni, I'm an adjunct at Uni SA now, but ours is my pathway was I wanted to make a clinical research framework inside our practice. And rather than look at, running through the grant system, I have been very lucky to some, funders like ASICS over a period of time to really support me and what I do. I think you've just got to be known and you've just got to be present. And at conferences, you've just got to have those questions and you've got to go and identify, well, who are the thought leaders? Who are the people who are head of research groups? Who are publishers? Who are those keynotes and invited speakers? And I always look at the younger ones, right? And that's when I started out, is I looked at the Lukes of the world and all of that who are, probably a couple of years ahead of where I was at the time, of going, you go to a professor in a university environment, a professor's got like 40 people underneath them that are doing a range of things and they can connect you, don't get me wrong, but they're not doing a lot of their own legwork. I've found that if you can make authentic relationships with individuals, and I've got a great one here in Adelaide, and we did our PhD together. But if you make authentic relationships with people early on where they've got the time for you, that is the best way. So I'd just reach out, make connections, hit people up at conferences and just go, look, I'm interested. Can I come? Have you got a study I can come be involved in? Would you mind if I come spend your time in the lab? Can I run a concept by you? What are some papers in this area? And just start that conversation, and you'll be surprised about what you can do. Because Pat, anytime you want to come and collect some data with me, feel free, because it's really expensive to get research assistants at the moment. So I can guarantee there's a lot of researchers out there who are more than happy for a bit of help. And I think the right person in the right environment, mate, people are always going to support, particularly in a small profession like podiatry. As I said, I've never been knocked back.
That's fantastic. I guess our final strides. Is there any research that, not that you've already discussed already, that's potentially you can leak a little bit more, some more teasers?
Um, what have we got going at the moment? Mate, I'm really excited by the new workbook that ASICS have just put out.
Mm.
We're going to talk more about that at SMA. We are in the middle of a project on that, don't get me wrong. And all I can say on that is you've got a whole industry that is huge that have forever been shortchanged, in my opinion, of heavy, uncomfortable, bulky footwear. We've finally got a company that's embraced a running shoe mindset and found a way to put a safety Australian standard approved upper and sole unit on that. And I reckon it's going to be an absolute game changer. And the data we've got, like we're dropping, best part of 37% of total weight without sacrificing stability, but improving comfort. Like they are big numbers. And so I think what we're able to do, and that's it's been really satisfying for me starting to work in some of these other projects. I love running, don't get me wrong, and I love what's happened in the running industry. But when you can start making changes like this in areas where it's not, investigating that is certainly starting to light another little fire in the belly, mate.
Mm. Fantastic. Um, I guess where can our listeners connect with you moving forward and learn more about your work?
Yeah, mate. So again, we are probably the world's worst business on social media. From my point of view, we are on social, so it's just at the Biomechanics Lab. Whether it's on Facebook or Instagram is the best way to hit me up. Or if you hit me up directly, email just chris at the biomechanixlab.com.au. Happy for anyone, any listener to reach out to me, and I'll always be generous with my time where I can be.
And of course, you'll be at SMA.
I will be at SMA. I will be at SMA. I will be at the Podiatry conference for a couple of days. I won't be there the whole time, but I'm doing a workshop up there with footwork. I'll be down in Hobart. I'm always at the SEPA conference. And yeah, whatever else pops up and along the time.
Chris, thanks for coming on to Soul Science. It was a pleasure.
Thanks for having me, mate. Really always good to chat.
Thanks for your time, Chris.
Pleasure.
Thanks,
Thanks, Darcy. Thanks,
Fish.
Harriet.